Good evening, students. It's your professor, Leonard. Um, Tonight we're going to do a small summary about what is cell hypertrophy. This belongs to chapter number 3 of the class of Pathophysiology for the B.S.N program. Okay, so we're going to go over the most important things about hypertrophy, and we're going to mention some examples. Hypertrophy represents an increase in the cell size. In other words, it means that the cells increase in size. And with increase in the amount of functioning tissue, it results from an increased workload imposed on an organ or a body part, like the one is commonly seen in cardiac and skeletal muscle tissue. Now, hypertrophy involves also an increase in the functional component of the cells, and this allows to achieve equilibrium between demand and functional capacity. Now, here is a picture of myocardial hypertrophy. This picture here shows a cross-section of the heart in which you can see the left ventricle has been hypertrophy. It means that all the cells at the microscopic level of the left ventricle have increased in size. This is one example of cell adaptation process of hypertrophy. Now, there are different types of hypertrophy. There is what is called physiologic hypertrophy. Now, this type of hypertrophy is the result of normal physiological condition. Like, for example, the increase in the muscle mass associated with exercising and associated with working out is an example of physiologic hypertrophy. Like when you go to the gym and you work out, you see your muscles increase in size. This is an example of physiologic hypertrophy. Now, pathologic hypertrophy occurs as the result of disease and illness, and also may be adaptive or compensatory. Examples of adaptive hypertrophy are the thickening of the urinary bladder from long continuous obstruction of urinary outflow, and the myocardial hypertrophy that results from valvular heart disease or hypertension. In other words, when someone have, like the picture showing here, have an enlarged prostate, this enlarged prostate, that is known as BPH, benign prostatic hyperplasia, it blocks the normal urine outflow out of the bladder. And as a consequence, the bladder extends and increases in size. And this is an example of adaptive hypertrophy. Thickening of the urinary bladder from long continuous obstruction of the urinary outflow. Now, myocardial hypertrophy also results from valvular heart disease or hypertension. So people that have long-standing hypertension, people who have valvular heart disease, the left ventricle, when pumping blood out of the heart, it has to work harder, and as a consequence, this increase in size and lead to myocardial hypertrophy. Now, there is also what is known as compensatory hypertrophy, and a good example of this is in the kidney. When people have, the people have two kidneys. If one kidney is surgically removed, the remaining kidney will increase in size of a compensatory hypertrophy. Now, the initial signal for hypertrophy, it appears to be a complex and related to the ATP depletion, also mechanical forces like stretching of the muscle fibers, activation of the cell degradation products, and hormonal factors. An example of hormonal changes in the hypertrophy heart is the increase in glycolysis. The process of glycolysis is increased. Therefore, there is an accelerated glycolytic rate, and the potential for adaptation in the hypertrophy heart is also increased. Now, remember, hypertrophy there is pathological hypertrophy, compensatory hypertrophy, and physiological hypertrophy. Physiological is the good one, pathological is not the good one, and there is a compensatory hypertrophy. Now, when you compare an hypertrophy myocardial cell of well-trained athletes that have increase in the size, you see their proportion increase in the width and the length is equal. Now, if you contrast and you compare the hypertrophy of somebody that has dilated cardiomyopathy, you will see that the hypertrophy cells have greater increase in the length than in the width, and this leads to a heart that works less than a normal heart. This hypertrophy, it doesn't mean necessarily that the heart works better. In the contrary, it doesn't work the way it should do.